In this procedure, you will learn how to administer an intradermal injection and read a tuberculin skin test. Read the provider's order and clarify any questions with the provider. You should never dispense or administer a drug without making sure the provider's order is legible and the details of the drug are known. If you are unfamiliar with the medication, refer to the PDR, online drug reference, or package insert to determine the purpose of the drug, common side effects, typical dosage, and any pertinent precautions or contraindications. Be prepared to answer any questions the patient may have about the medication. Use the 7 rights to prevent error. The right patient, the right drug, the right dose, the right route, the right time, the right technique, the right documentation. Dispense the medication in a well-lit, quiet area. Assemble the required equipment. Choose the correct syringe and needle unit, depending on the site of administration, patient characteristics, and the amount of medication to be injected. Before you dispense the medication, sanitize your hands. Compare the order with the label on the vial of medication when you remove it from storage. Check the quality of the medication and the expiration date on the container, and dispose of the medication if it appears contaminated, contains sediment, or has expired. This is the first of 3 label checks. Examine the label on the vial of medicine again just before dispensing the ordered dose. Make sure the strength on the label matches the order, or that you dispense the correctly calculated dose. Warm and mix refrigerated medications by gently rolling the container between your palms. Clean the top of the vial with the alcohol wipe using a circular motion. Place the vial on a flat surface. With the needle cover in place, grasp the syringe plunger and draw up an amount of air equal to the amount of medication ordered. Remove the needle cover. Hold the vial firmly against a flat surface and insert the needle into the center of the rubber stopper. Careful that the needle touches only the cleaned rubber area. Inject the aspirated air in the syringe into the vial. Keeping the syringe unit in the vial, pick up and invert them. Slowly pull back on the plunger with the unit at eye level and draw up more medication than ordered into the syringe unit. While the needle is still in the vial, check for air bubbles in the syringe. If air bubbles are present, move the fingers holding the vial down to grasp the vial and syringe as a single unit. With your dominant hand now free, use it to tap the syringe until the air bubbles dislodge and float into the tip of the syringe. Inject the air bubbles back into the vial with the extra medication that was withdrawn. At eye level, make sure the accurate amount of medication is in the syringe unit. Withdraw the needle from the vial and carefully replace the needle cover without letting the needle touch the outside of the cover. Return the medication to the shelf or the refrigerator, checking the order against the label one more time to complete all 3 label checks. Prior to entering the exam room, knock on the door and give it a moment. Greet the patient and identify yourself.
Come in.
Good morning, Tina.
Good morning.
How are you this morning?
I'm good. How are you?
I am good. My name is Tori. I am Dr. Shyman's medical assistant. I want to verify a few things with you.
Okay.
Can you give me your name
It's Tina Lakin,
and your date of birth?
4/21.
Verify the patient's identity with her full name and date of birth. Make sure the patient's information matches the order and the record. Provide the right education to the patient. Explain the medication ordered, provider ordering the medication, the desired effect, and common side effects. Answer any questions the patient may have. Use language the patient can understand.
Tina, Dr. Anderson has ordered a TB injection for you. It's a 1/10 of a milliliter of tuberculin right up under the skin.
Okay.
Ask the patient whether she has ever had a positive reaction to a PPD injection or TB test. If yes, report this information to the provider before administering the medication. An individual with a history of a positive PPD test result always has a positive result because of antibody action. Ask the patient if he or she has any allergies.
Have you ever tested positive for TB before?
No,
Okay. Do you have any known allergies of any medications?
not that I know of.
Ask the patient if she can return in 48 to 72 hours for the reading.
And will you be able to return in 2 to 3 days to have this read?
Yes.
Then find out if she has ever had a BCG immunization. Sanitize your hands again and put on gloves. Have the patient extend a forearm with the palm facing upward. Identify an appropriate site for an injection. The site should be 2 to 4 inches below the elbow, free from veins, scars, or wounds. Loosen the cap on the needle so that you'll be able to open it with one hand once you clean the injection site. Open the alcohol wipe. Place your non-dominant hand on the back of the patient's forearm to pull the skin taut. Another option is to wrap your thumb and the first 2 fingers of your non-dominant hand around the patient's forearm, pulling downward and apart to stretch the skin taut at the location of the injection. Cleanse the patient's skin with an alcohol wipe using a circular motion, moving from the center outward and creating about a 2-inch area. Allow the antiseptic to dry. Pick up the syringe and tip it to remove the cover. Grasp the syringe in your dominant hand. Use your thumb and index finger. Make sure to have no fingers under the syringe. Ensure the bevel is up. With the bevel up and using a 5 to 15 degree angle, slowly insert the needle until the bevel is covered with skin. Carefully lower the syringe to the skin and hold it steady with your dominant hand. Move your non-dominant hand to the plunger. Slowly and steadily inject the medication by pressing on the plunger. If a 6 to 10 millimeter wheal does not appear, repeat the test at least 2 inches from the site. Double-check the barrel of the syringe to make sure all of the medication was administered. Withdraw the needle. Activate the needle's safety device with one hand. Discard the needle and syringe in a biohazard sharps container. Make sure to put the needle in first. Do not massage the area. Offer a bandage. Place the bandage on very loosely to just absorb any blood from the site. Some offices will not allow the use of a bandage. Observe the patient for any adverse reactions. Clean up the area. Discard all waste in the biohazard waste container. Sanitize your hands. Document the procedure in the health record. Include assessments done, patient allergies, teaching or instructions provided, the provider ordering the medication name, dose, route, and how the patient tolerated the medication. Also include the manufacturer, lot, and expiration date of the vial. When the patient returns in 48 to 72 hours, check your documentation to identify the location of the test. Sanitize your hands again and put on gloves.
All right, Tina. I'm going to take a look at your left arm where we gave you the TB injection.
Palpate the site for an induration.
All right, everything looks negative. That's good. Do you have any questions?
What would it have looked like if it were positive?
Well, if it was positive, it would be raised off the skin with some swelling and inflammation.
Okay. And then what would happen?
The doctor would order more testing to confirm that it's active.
Gotcha.
And then talk about the treatment process.
Okay.
Okay?
If an induration is felt, ask the patient if you can write on her arm. Using a ballpoint pen, draw a line towards the induration from the outer edge of the arm. Repeat on the other side. With a disposable millimeter ruler, accurately measure the distance between the 2 points. Dispose of your gloves in the biohazard waste container. Then sanitize your hands. Document the reading in the patient's health record. Include the reason for the patient's visit, the arm read, the size of the induration in millimeters, and the provider notified.